Welcome back. We close chapter 9 where truthfulness becomes personally costly. First, error disclosure. Every practitioner will make mistakes, everyone. The ethical question is what happens next? Patients have a right to know what happened in their own care. The framework is straightforward. State the facts, acknowledge what occurred, and explain what will be done about it. And here's the finding that surprises students. Honest disclosure often reduces litigation rather than increasing it, because much malpractice litigation is driven by patients feeling deceived or stonewalled, not by the error itself. Connect this to Chapter 2. Truthfulness is a specification of the love of neighbor command. The patient wronged by concealment is wronged in her standing as a person, but let's be honest about why disclosure is hard. Shame, fear of liability, the instinct to minimize, and institutional cultures that reward silence all push against it. Doing right here takes real courage. Now, the hardest duty in the profession, reporting an impaired or unethical colleague. What's reportable? Impairment, substance use or illness that endangers patients, sexual misconduct, fraud and serious billing misconduct, gross incompetence or conduct that endangers safety. Why it's hard: collegial loyalty, fear of being wrong, and genuine reluctance to damage someone's career all weigh heavily. But the standard is risk, not proven harm. Waiting for the bad outcome in a sedation or surgical setting is itself a failure. In many cases, a direct, compassionate conversation and a pointer to a well being program is a legitimate first step, but it cannot become an excuse for indefinite inaction because the patient's safety is the non negotiable. And often, the most caring outcome for the colleague is the one that gets him into treatment, not the one that protects the secret. And the hardest mirror of all, the duty to recognize when the impaired or struggling practitioner is yourself and to have the humility to seek help. Self accountability is part of the duty. The sentence to carry: the integrity of the profession depends on truthfulness applied everywhere it's tempting to bend it. Next, Chapter 10, the capstone: who the dentist becomes across a whole career.